Well, as the administrator and director of the clinic, I found the biggest challenge for me is being able to keep employee morale going, because many people were very concerned, very apprehensive in the early days of having to work in a COVID environment.
Well, I think it's presented a lot of challenges. Specifically on my end, being a psychiatrist, I've seen a lot more anxiety kind of in the average person. So dealing a lot more with stress and anxiety has been a new reality for, I think, a lot of us, but especially on my end.
It's been challenging, dealing with the patients, because I work very close with patients with a very close distance. It's been challenging because we work with lenses which tend to fog up, and then, we have to spend extra time disinfecting between patients. So it's been a challenge, but we've gotten used to it.
Kind of changed the dynamics of things. Like, I think the hardest thing for us was the patients that had like comorbid factors, that they kind of got put on hold and they were handled over the phone for a while. And so when we finally got to start seeing them again, it was like an influx of patients that had things to be taken care of immediately. So that was probably the biggest, I think, hurdle that we've had to get through, trying to get those patients stabilized and everything kind of back to normal for them and support them. And then I think that's probably been the biggest part of that.
It's been a totally new normal. I'll say that. We, in the beginning, didn't see a lot of patients because we didn't want our high-risk patients coming into the clinic. And so we started doing some televisits on the telephone with patients. And originally we had tents set up outside to test the sick patients. And in the beginning, we really didn't have that many coming in. So the tent came down, and then we had an explosion of new coronavirus patients.
There's a lot that goes with it that most people wouldn't think about. I mean, there's a lot of behind-the-scenes stuff that happens. It's frustrating when you see people not wearing their mask, and then you're dealing with people that are hospitalized and are sick, and it's just a busy, kind of sad time.
Social distancing and masks, washing hands frequently.
Hand washing is probably, outside of the mask, I think hand washing is just the most important thing that we can all do.
Wash your hands, don't touch your face. That's huge these days, and that goes for flu, any virus.
Well, if you've been asked to quarantine, you need to follow that to the letter, to the last day. You cannot go on whether you have symptoms or not. That is not a reliable sign of whether you could be infected. We know that many, many patients who are on quarantine will eventually become infected, and they may or may not have symptoms. So don't be deluded or tricked into thinking, I feel fine, it's my 10th day of quarantine, the heck with it, that seems unnecessary. The clinic and the contact tracer were too heavy-handed in placing me in quarantine. I didn't really need it all along, but yet on day 12 they test positive. And so we've seen that time and time again, and now they've exposed family, friends, and maybe even workmates to COVID-19, and now more people need to be quarantined. Or the other one is that people are mildly ill and don't realize those could be early signs of COVID, and they go to work anyway. Many people have the impression that unless you're pretty sick, surely it couldn't be COVID. We hear about the worst cases that are in the hospital on ventilators, but we don't realize, in addition to the asymptomatic, there are people with few symptoms. Scratchy throat, congestion, very commonly symptoms just like the common cold. But they think, surely this can't be COVID, and they go to work, they go out in the community, they don't make arrangements to be tested, but yet they've got COVID-19 and they've been all in the community. So being mindful that even mild symptoms could be COVID-19 means you should stay in until you can get tested. And if they want to retest you in a couple of days, follow the testing protocol and quarantine. It's tough to quarantine, I realize that. Nothing easy about it, but that's how we protect others, and particularly our family members and our workmates, from spreading COVID-19, even though we may not be ill or very ill.